Thank you very much, Congresswoman Donna Shalala. We're so pleased that you are with us at our Better Medicare Alliance's MA Summit. This is your second appearance. You came last year as well. And of course, it's a little bit different doing it virtually than we did in person when you were interviewed. But you were great, and really everyone appreciated it, so we welcome you back. For those in the audience, and I can't imagine anyone won't know you in this audience of our allies and other stakeholders who care deeply about Medicare, and particularly Medicare Advantage, of course, that you're a first-term Congresswoman from Florida's 27th district, and you were on the Rules Committee. I know that means you're a little bit involved in just about everything that happens on the floor of Congress, every issue. Healthcare is obviously something you care deeply about, but many others as well. And you also serve on the Education and Labor Committee. So it's wonderful to have you in Congress. We're delighted that you are a Medicare Advantage champion on our website, and and that you have stood up for Medicare Advantage. So welcome, and we have a few questions, and I'll start by but just saying it's hard to begin a conversation these days without some discussion about the pandemic that we are living in the midst of. This COVID-19 has hit all of us. It's obviously hit the healthcare sector in a bigger way than has ever happened before in, I think, my memory certainly, but I think in the history. And so I would just ask you this, not to go over where we've been, but just what advice you have for our stakeholders or for this administration. What do you want to see happen now as we go forward, as these months continue of social isolation and masks and concerns about the economy, of course. But what's your guidance to, what would you like to see happen?
We need more discipline at the state and local level as well as the national level. I did a bill with Jamie Raskin, Representative Raskin, early on that basically laid out what each level of government should do. But basically, the federal government should have taken a stronger hand in buying the PPE, for example. That would have been extremely important. Using the Defense Procurement Act would have been very helpful. Instead, we had chaos out there with states competing against each other and hospitals competing against each other. So just getting the right equipment, the right safety equipment to everybody would have been a fundamental rule, and setting a real standard that we had to have masks. We had to have masks on everyone, that in wearing a mask, you protected the other person. No one wants to close down the country, but we should have closed down really with a lot of discipline. If we had done that, we could have gotten far more containment, and that would have made a difference in our ability to do contact tracing and everything else. But basically, it's been chaotic because we haven't had national leadership, and we've had intermittent state leadership depending on where you live. That can't happen when you have an infectious disease, because it doesn't know what political party you're in. It has no idea what borders it's crossing. And we needed to pull the country together, and we just didn't do that. And as a result, more people died than should have, than would have died if we had had a much more disciplined strategy. I am extremely angry that we didn't put our act together.
You know, you're right. Now, for those of us certainly who are in colder areas, we do worry about what does it feel like, now that, going into fall and winter, and it'll be rough on people. It really is. So we looked at that national leadership, you're right, the fact that state by state it was so different, but we have gotten a little bit used to this new normal. So, hopefully we'll keep taking it seriously and keep a handle on this. But here
no one should get used to people dying unnecessarily.
Good point.
That's my point.
Yeah.
No one should get used to that. Everybody should be up in arms and looking for a way to reduce the number of deaths. This is really about life and death, and all of us have to be committed to saving lives.
No. Point well taken. And you're talking to a group of healthcare people who all either been on the front lines or really get this. So following the science, doing what's right for ourselves and for their neighbors is key. And obviously for seniors, it's particularly important. So we'll keep reminding people about that as well. And it will all that we do in healthcare in the next months ahead. It's going to really still have an enormous impact, as it has on, we've been proud of, let me say this, of what Medicare Advantage has been able to do, because it's an integrated system and reaching out to people and making sure that they get the kind of care that they need. But it's been a stress, and it will continue to be one that we all have to take quite seriously. Well, Congresswoman, as not everyone may know, you are the longest serving HHS secretary in the history. Tough job, important job. Thank you for your service there. And it turns out that under your leadership there at HHS was the beginning of Medicare Plus Choice, which was the beginning of Medicare Advantage. So it really, could you have, I guess, we give you some credit for all this, for all this happening. Congress obviously had to pass it, but it was a beginning of what we see today, which is a really change to a drive to value, integrated care. Let you describe further, but could you have foreseen the popularity of Medicare Advantage and where it's come to, and lessons learned? So your early thinking on this, I think people would appreciate, and how you have seen it progress.
We had a mixed experience with HMOs. And we ran the economic incentives the wrong way in terms of trying to cut down on the costs of healthcare. So why not put a little bit more money into the system and see what the industry can do in terms of integrating care, giving them a little bit more flexibility. So I was not willing to give up on the concept of integrated healthcare. But it required a very different design, and it required bipartisan support. Could I have anticipated that it would sweep across the country, particularly in Florida? My district is 70% Medicare Advantage. In fact, I yelled at the Secretary of HHS a couple of months ago because they distributed the money for providers based on traditional Medicare. And I said, you're discriminating against us that have lots of Medicare Advantage patients and a lot of other states and providers at the same time. So I think it's worked out pretty well. There's a lot of discussion about whether we've overpaid now in the system. And the studies are not fine-tuned enough, I think, still to tell us all the advantages. But it was worth, every once in a while, it's worth spending more money to see whether you can get some outcomes that you want to get, and to have some confidence in the healthcare providers, in the professionals, to see what they can do if they have more flexibility and more resources. So
interesting, that whole idea that I think the original concept was a little more money up front, but then for the same amount of money we spend for fee-for-service, we could move people from the fee-for-service system into a value-based, integrated network of providers, and really a more holistic view. And, under the ACA, as you may well know, 10 years ago, they took care of that idea of, well, we're paying too much, and said, okay, we're going to get Medicare Advantage even with fee-for-service. It took 7 years, but MedPAC has said it's basically paid the same equally to fee-for-service. So for this, basically the same amount of money as fee-for-service, beneficiaries are getting that integrated care you've talked about, that drive away from fee-for-service and fragmented, often confusing and disjointed system. And that is also kind of wasteful financially
but
for many.
It would have happened if we didn't put more money up front.
Yeah, you're
because
right.
We had to find the right balance. We couldn't have done it if we started the way people asked us to, just give us the same amount of money for traditional Medicare, and we'll be able to do better.
Well, we certainly know that the plans, the health plans, and now increasingly providers are coming in to this value-based system. But you're right, the idea that investments had to be made, and they still need to be. It still is a hurdle for providers to say, well, how do I do the kind of technology I need for an integrated system? How do I do that kind of work? How do I hire the extra staff before I know that it's going to work? So thank you for your vision. And look where it's turned out. 40% of beneficiaries have chosen. In your district, you're right, at almost at 70%. It's quite extraordinary. Which brings me to another point, and you talked about your district, is that Medicare Advantage has been particularly attractive to low and modest income folks. and also to minorities. There's a higher percentage of African Americans and Hispanic seniors who've chosen Medicare Advantage. Over half of Hispanic seniors are in Medicare Advantage, and it's their choice. They're marching with their feet towards this more integrated system. So talk about that a little bit. What do you hear from your constituents about their Medicare Advantage and the kind of care and benefits that they get?
Well, we have some marvelous examples down here in South Florida. What I hear from seniors is they want simplicity. They want high quality care, but an easy way to access it and to access all of it. They don't want to be shunted around, whether it's for their dental care or for their health care. If they have to see a specialist, they can get that referral. But as they get older, they want the system much more simpler than a kind of traditional fee-for-service system. When I first came to Miami 20 years ago, there were billboards for specialists. I had never in my career ever seen a cardiologist advertise, or a neurologist advertise.
Yeah.
But there were billboards. There aren't now because we've got such integrated care and a referral system that's been set up. Now, the high end hospitals complain about what kind of payment they can get because the Medicare Advantage plans negotiate hard, but that kind of thing has to respond to the market. And, we knew we weren't going to get it exactly right. So what worries me about the healthcare system in the United States, particularly the government-run healthcare system, is we're not nimble. We passed the Affordable Care Act, and we didn't pass the technical changes that we should have made after we had some experience with it. And I worry more about our inability to fine-tune, to listen to the people that are running the health systems in this country and make the changes that will improve the quality of education, of the quality of healthcare.
Actually, it's a great point, because one of the things that we at Better Medicare Alliance really appreciate about Medicare Advantage is both they have that ability to be nimble. We use that word, as a matter of fact, which is great. And they have the ability to innovate, to try new things. It's very difficult to do for the entire country, for everyone, without really having some chance to explore and figure out what works. And we're seeing that happen now all the time with what kind of care teams do you need? What kind of primary care team? What should it look like? Who should be in that team? And what about new sites of care? Can we actually keep people out of the house and out of the hospital, and be able to innovate and to be nimble? You're right. That's what a public-private partnership really does. Good government oversight, but then a chance for the private sector to take that kind of action and be responsive, because the world's changing. Healthcare, I guess telehealth would be an example of that, right? Where Medicare Advantage could step up pretty quickly. And now we're still sort of working out with CMS what's going to be permanent, what's not, what's going to be reimbursed, what's not. Which is fair. It's the whole, the whole big system, but it's not nimble. It's very hard for the government to be nimble. Maybe one last quick question, which maybe isn't so quick. Without it anticipating the election exactly, obviously people are interested in what you would like to see, maybe what you want to see, what the Democrats want to see coming from Congress, possibly with a change in president, but going forward, what else do you want to see happen in healthcare in particular? What do you think what are the top priorities likely to be?
Well, the top priority is COVID and getting our arms and building the public health infrastructure so we can respond to the next pandemic. So we're not scampering around. So we're really prepared. But we want to expand the Affordable Care Act. We didn't get the subsidies right in the Affordable Care Act. And we knew that at the beginning, so that we need to make changes there. We need to entice some states to expand Medicaid as part of the Affordable Care Act. There's no question about it. For Medicare, we actually need to add resources for more benefits. We've got to deal with the long-term care issue in this country.
Huge issue.
We cannot just depend on Medicaid and on people spending down. Medicare has to have something in it beyond you can get home health care after you come back from the hospital. And we've got to figure that out a lot more people would like to stay at home, I think, after the COVID experience, as opposed to institutionalized care. But people ought to have the options, and we ought to figure out a way to pay for the workers and not to put them in abject poverty. People ought to be able to be a home healthcare worker and support their families at the same time. We ought to be able to attract high quality people. We have high quality people, we just underpay them now. I know from my own experience with my mother, who lived to 103, the last couple of years we had 24-hour care, and I just paid those home healthcare workers, once we sorted out who we were going to have, much more than their agency was paying them. And my mother actually left money for the two of them to go to nursing school. And both of them have BSN nursing degrees now, because she was so concerned about their future and not very concerned about my sister and I and whether we needed to inherit any money at all. But it was a perfect, she was a teacher and a lawyer, and she understood what the career track was. And she kept talking to me about the fact that home healthcare workers needed to be better supported. So I've kept that in mind. And certainly long-term care we all want to deal with, but we also want to fix Medicare. I'd like to up the reimbursements for Medicaid, but there are some things we can do in Medicare that will make a difference in terms of extending life.
Well, great agenda. And thank you so much for your leadership on healthcare and for being a champion of Medicare Advantage. Your voice is extremely important in Congress and for seniors and those with disabilities who are in Medicare. So thank you for your work. Thank you for your service. And we at BMA look forward to continue to work with you.